Welcome back. This video in the Active Skills Health Hub aims to help you understand more about what can be done for a condition called stenosis. After noticing that pain gets in the way of household activities like cleaning or heavy legs limit walking, someone said, "That looks like stenosis." Now what? How do you move forward from there? Fortunately, healthcare providers have the answers. And increasingly, it seems that first-line best practices, the treatments that healthcare providers expect to have the best outcomes and are often recommended to try first, use just some simple strategies. These strategies are expected to help a person better manage their symptoms from stenosis and their ability to function. Before diving deeper into some of those best practices, you may want to understand the ideas behind them. You can learn more about stenosis by clicking the link that's on your screen now. As a strategy, encouraging people with stenosis to be physically active and helping them to participate in their own health is considered essential. For many people with stenosis, first-line strategies center around exactly that, helping people to get active again, improve their ability to function, and then sustainably stay active. Patients with lumbar spinal stenosis typically receive non-operative care as a first-line treatment. The non-operative options that had usually been considered include strategies like medication or injections. Of course, medications and injections require you to speak with your healthcare provider. These days, healthcare providers are growing confidence in another non-operative strategy. This strategy actually uses a combination of approaches that build the knowledge and skills to help a person manage their condition better. A healthcare provider using this strategy can combine any or all of education about the condition to help you understand, plan, and respond better, lifestyle and behavior changes to be more strategic with movements, and exercise tailored to the person's needs and abilities. For an idea of some of the type of movements and exercises that could be recommended by a healthcare provider, click the link that's on your screen now. Manual therapy provided by a chiropractor or physiotherapist should also be on the list of options discussed with your healthcare provider. Using a combination of these different approaches or modes of treatment is called multimodal care. In the big picture, stenosis is more than a small inconvenience. You might be surprised that a person with stenosis could find themselves with even more walking limitation than somebody else with conditions like hip or knee arthritis. Disability can then impact a person's quality of life or even their emotional state. In fact, losing the ability to walk is the reason many people with stenosis seek the care of healthcare providers in the first place. So, strategies that incorporate movement, exercise, and the ability to function are often a great match to patient goals. That's called patient-centered care. A recent study, at least at the time of making this video, compared the effectiveness of some non-operative treatments. A multimodal strategy, in this case one that combined manual therapies, like those often provided by a chiropractor or physiotherapist, with exercises targeted to the patient's goals and abilities, was used. The multimodal strategy helped people to improve their walking. Importantly, the improvements achieved with the combination of these simple strategies was similar to the improvements found with other first-line options. Here's the neat part. The improvements stayed similar at 2 months into the study, and even further down the road at 6 months into the study. So, like the authors of that study point out, it might be in the best interest for people with stenosis to be able to discuss all the effective treatment options with their healthcare professionals. Someone you know, somewhere, is suffering limitations due to lumbar spinal stenosis. Like this video, share it, and then subscribe to learn more. The information on this site is provided only as a resource for discussion with your own healthcare provider. You should consult your healthcare provider before making any healthcare decisions.